So, welcome everybody. We're really glad you're here joining us today for this webinar. Uh, we're we're again just so glad you joined us. And the webinar this month is Equip Your Home and Empower Your Health, exploring accessible home health aids for people who are blind or visually impaired. Today's webinar is going to last about an hour, and there's several points during our training where we're going to give you a chance to ask questions or comment, but just some housekeeping now so that all of this can be as smooth as possible. We've got a good number of attendees this month. So everybody's going to be muted until the question and answer sections happen. And if you have a question at any time, though, you can raise your virtual hand. And again, if you're using Zoom on a PC, to raise your hand is Alt-Y, and to lower it is again Alt-Y. And if you've dialed in by phone, *9 is to raise your hand, and *9 again is to lower, and *6, I think Everett said, was to mute and unmute. So this, when you raise your hand, is going to make it easy for our moderator to see you at the top of the list and call on you. And another piece of information, if you're called on, you must also please be sure to unmute yourself before speaking. So we'll give you permission to speak, and then you also have to unmute. And our moderator today that's going to be handling all that awesome stuff is Elena. Thanks so much for joining us and be such a really, really important, crucial part of this team. This webinar today is brought to you by the Lighthouse for the Blind Incorporated. Our organization is headquartered in Seattle and has manufacturing facilities in Seattle, Washington, Spokane, Washington, and Somerville, South Carolina. And at those locations, we make lots of different kinds of aerospace parts and a variety of products for the U.S. government. We also own and operate base supply centers up and down the West Coast, and those are located on military bases. And we also provide contract closeouts services for the military at our locations in California, Alabama, and Virginia. So we've got a number of different locations, but our mission is the same across all those locations. It's to empower people who are blind, deafblind, and blind with other disabilities by creating diverse, sustainable, and meaningful employment opportunities. And we're currently hiring. So if you are interested in a job with us, or you know somebody who's blind, please scope out our open positions at lhblind.org/jobs. And you'll be able to see if there's a job for you. Elena's going to put that link in the chat right now for you, lhblind.org/jobs. So the webinar today is one of several exciting things that we're doing as part of some new community-based programs and services that we're going to be launching over the next couple of years at the Lighthouse. So stay tuned for more, and feel free to reach out to us with questions. And please share any of this info with people you think might benefit. One final note here for this introductory stuff is that tomorrow you're going to receive an informational email with detailed notes and relevant links on the apps, services, and other items that we're going to be covering today. It's a great resource. I've heard from a lot of people that it really helps. There's also a link in that email to a survey that we would really appreciate you completing. What you tell us actually matters, I promise, and we've already implemented several of the suggestions that people have made for future webinar topics, or kind of the flow of things and questions and answers. And we've just implemented a number of things that people have suggested. So, introductions. Hey, my name is Tim Paulding, and I manage our computer training programs, both deaf, blind computer training and our computer training program for hearing blind, and our Braille literacy program at all of our locations. And I'm actually located out of our Spokane location. And at that location, I teach orientation and mobility. I've been in the blindness rehabilitation field now for about 15 years. 10 of those have been at the Lighthouse. I've taught assistive technology and orientation and mobility for most of that time. And I also happen to be blind. Everett? Uh-oh.
Okay, I think my Zoom maybe needs some medical assistance.
There.
Can you hear me?
Yes. Yes, we
Hello, my
can.
name's Everett. I work at the Lighthouse here in Spokane, same as Tim Paulding. I teach computers and assistive technology, anywhere from iPhone to Android. I also teach Windows skills and keyboarding, so wear quite a few hats in the teaching field. And I also love to run and play fiddle. So that's just a little bit about me. Been in the rehab field for 7 years, loving every second of it, as we all do. And yeah, looking forward to presenting on some medical information here. Oh, one more
Awesome.
thing is the New Year's webinar that we did pairs pretty well with what we're doing today. It was done January, and it had some stuff about fitness. We had Tyler Marin on, who is a Paralympic gold belt champion. So that might be something to check out in sort of a companion to this webinar.
Absolutely. Yes. And you got the webinar outline objectives for us, I think.
All right. So the next thing we're going to do is more housekeeping, of course. We're going to talk about what you're going to learn slash get from this webinar. So I have just 3 objectives that we're going to read over together today. The first one being that webinar participants will gain understanding into accessible products through short videos and demonstrations. So we're not just going to sit and talk your ear off for an hour. We're going to put our money where our stethoscope is. Next objective is we're going to gain valuable knowledge and insight into accessible technology accessible technology and resources available for your health and wellness. So we're going to give you an idea of some pharmacy resources and some marketplaces that you can go to so that the doctor doesn't come calling unless he needs to. And the last objective is you're going to be provided with a list of accessible resources and products. And that's just that email that Tim was telling you about just a few minutes ago. Just a refresher, I made a mistake. Alt Y will raise your hand on PC. Star 9 will raise your hand on a touchtone phone. Star 6 to mute, and Alt A to mute on Windows.
I thought you said that. I could have glossed over that, but
I believe I said Alt U.
oh, you. Mm.
The U and the Y are very close together. That's the story I'm sticking to.
On the keyboard, yes, sir.
Yeah,
They are. Well,
yeah.
thanks, Everett. And absolutely, we did a really cool webinar in January. It was all about kind of New Year's resolutions and looking into different ways to improve your health and your finances and your mental health. And you can go to YouTube and look up the Lighthouse for the Blind, INC, Lighthouse for the Blind Incorporated, and you get to look at all the different webinars that we've done on our YouTube page. That link is also in that handy dandy email that we've been talking about, that you'll get 24 hours after this webinar. If you registered for this event, whether you attended or not, you'll get the email. So no worries on that. So the first thing we're going to talk about is the accessibility of prescriptions. So when you go to the doctor and they write you a prescription, and then you'll go to a pharmacy like many of us have, and speak to a pharmacy tech, pick up your prescription. And usually what happens, at least for me, is that a pharmacist, if I want them to, will come over if it's a new medication for me and tell me about the medication and talk to me about the dosage and how much and how often, with food, without food, etc., how long. And then that's it. I go home, I bring my pill bottle home and put it somewhere, and that's about it. So what we wanted to do is find the resources out there for people that will help them gain access to their prescriptions. So some of the things, and we're going to be covering that in just a sec, but some of the things that I do is that some of my prescriptions, the pills, are shaped in a certain way. So you can kind of use that to feel what type of pill it is. I also use an app on my phone to read the label of the prescription, but oftentimes with like Seeing AI or other optical character recognition apps on your iPhone. It struggles reading things that are on a round surface. You can also get family members to help you, but this is all about independence. And so there's a couple of solutions out there that are pretty widespread. They seem to be in many, many different places. The first one is called Script Talk. So this is, and we're going to watch a video on this real quick, but this is basically many different pharmacies participate in this program, and you can call and request it, or when you go talk to your pharmacist right there, and they have a specialized tag. It's an RF tag that they put on the bottle that you can either get a machine sent to you that reads the tag, or you can download an app that reads the tag on the bottle. And the tag contains all kinds of information about that medication, that specific medication for you, what the dosage is. The pharmacist writes it up, puts it on this little tag, and you are able to either use a machine that they send you that's super easy to use, or you can download an app. The only thing that your phone needs is a NFC chips, near field communication chip in it. Pretty much all phones have that now. The first NFC chip came out with the iPhone 6, which was way back when I was Everett's age in 2014, and and we're not going to talk about any of that. But Elena, let's look at that video, and we'll talk a little bit more about it afterwards. But it's pretty slick. This is called Script Talk. Not hearing any audio.
In this video, you'll learn how to use the free Script Talk mobile app to speak the information contained on your medication labels. Script Talk is a free system installed by your pharmacy to help you independently access your prescription information. Talking prescription labels are critical to ensuring medication safety and independence. The Script Talk mobile app was designed with you in mind and is available for both iPhone and Android. The app takes advantage of accessibility features like TalkBack and VoiceOver. Today, we'll discuss the iOS version of the app, but rest assured, both are very similar in the way they are used. So, let's get started learning how to use the Script Talk mobile app. First, take a moment to download the mobile app from the App or Play Store and run through the registration. Script Talk uses a special electronic label placed on your medication container by your pharmacist. This special label uses RFID, or radio frequency identification, to relay the vital prescription label information to your Script Talk mobile app. Now, at the top of the Script Talk home screen, there are two options to access your label information: Full Scan and Quick Scan. Full Scan will read all the prescription label information out loud, including drug name, dosage, instructions, and more. This function will run through all the information on your label. Once you select Full Scan, find the RFID tag on the prescription package. It's a small, circular electronic tag that is typically placed on the bottom of the prescription bottle by your pharmacist. With your phone facing up, hold the prescription bottle facing down on the top of your iPhone screen. The bottom of the bottle will touch your screen. The iPhone will pick up the information in your electronic tag and read your label information out loud. You may have to move the bottle around a bit until the phone reads the information. Let's try one now, holding the medication over the top edge of the phone.
Patient name, John J. Smith. Medication, amoxicillin 250 mg capsule. Instructions, take 1 capsule 3 times daily.
Pretty neat, huh? The Quick Scan function, on the other hand, will read only the prescription name and dosage for quick and easy identification. You see, it will repeat the name until you remove the medication from the top of the device. Let's try it.
Amoxicillin 250 milligrams capsule.
That's all there is to it. Your vital prescription label information is available to you whenever you need it, wherever you need it. If you're using an Android phone, you will instead hold the bottom of the bottle to the back side of your cell phone, very close to where your camera is located. Simple, isn't it? Some additional features of the ScriptTalk mobile app include a My Meds button, a Pharmacies button, and a Help button. The My Meds button will pop up a list of all the medications you have scanned with the full scan mode. This list is particularly useful when you're at your doctor's office. The Pharmacies button provides a zip code lookup of all the pharmacies near you that offer accessible prescription labels.
Results. There are 8 scriptability pharmacies within 5 miles of 3, 4, 2, 2, 1.
Finally, the Help button offers a full overview of the ScriptTalk mobile app and its features.
The ScriptTalk mobile app is used to read ScriptTalk RFID prescription labels. Is your pharmacy a scriptability pharmacy? If not,
Thanks for taking the time to review the ScriptTalk mobile app. Remember, if you need assistance finding a pharmacy near you that offers ScriptTalk, please call Envision America at 1-800-890-1180 or visit www.envisionamerica.com.
So that was all about the app and what you can do with these tags on your prescriptions with an app. There's also a device that Envision can send you free of charge, so you don't have to use your phone. So for maybe people who are not comfortable with smartphones, who don't have a smartphone, you place your medication in this. It's like the size, they described it as the size of a CD, an old school CD player. So then you just set it in there and it reads it to you, and it had really similar features and easy to use, easy to fill buttons. So that was ScriptTalk. In that informational email that you'll receive is a link to you can actually do a search online without downloading the app to see where the script ability, so ScriptTalk, what pharmacies are participating. I did a 99208, which is our work zip code, and there were like 10 pharmacies. So there were several Rite Aids that participated, Costco, Walmart. It's a lot of these places have adopted this as their accessibility feature, so it's pretty cool. CVS decided to go their own way. So everybody, CVS, there is, I think, 1 or 2 CVS pharmacies here in Spokane. There's some in Seattle, but they're pretty widespread out east. And they went their own direction and did something extremely similar to ScriptTalk, but you use this CVS app. It uses an RFID tag, and I have a really short video here from Molly Burke, blind YouTuber extraordinaire, who is I think she was probably paid to put this video together, but it's pretty slick, and it just shows you what this CVS, it's called Spoken RX from CVS. So if you'll run that video, Elena.
I'm blind, and the sticker on the bottom of this medication bottle is literally life-changing. This is an RFID sticker, which allows me to be able to read the important, but also sometimes personal information that I need to know about my prescription medications. Spoken RX is a feature that's available in the CVS Pharmacy app for anybody who's visually impaired or just struggles to read the tiny print that is on these labels, so that you can get all the important information that you need, not only about your prescription, but about your pharmacy. I have the CVS Pharmacy app open already, and my screen reader is on. There's Spoken RX, and then I just hold it under the camera on my phone. Boom, all the information I need comes up. It's that simple, it's that easy. It is available nationwide at any CVS pharmacy. It is free to sign up, so if this is something you think you might benefit from, I would definitely encourage you to call or go in store to talk to your pharmacist. It can read so much important information, from the patient name and prescription name to the dosage and expiry date and so much more, and is available in both Spanish and English. I'm blind, and the sticker on the bottom of this medication.
Boom. Now that's my kind of video. Everything you need to know in a minute. So really, just really quickly, she was using an iPhone. She had her speech rate on pretty fast, but what she did read on the screen was that she was using the CVS Pharmacy app. Totally similar. It seems like basically the same technology that CVS is using to kind of accomplish the same thing. But if you like your CVS Pharmacy instead, and those are the two kind of largest ways that people are gaining access to prescription information from pharmacies. And now we have a time where we're going to open it up for questions, you guys, before we move on to our next segment. So any questions about the kind of the preliminary stuff that I covered about the lighthouse and different things, or about Script Talk or Spoken RX?
All
Wow,
right.
there are many questions.
Yeah, we got
Oh,
quite a few here.
wow.
First one is from a 1510
510.
number. So I'm unmuting you right now. If you can also unmute yourself. Oh,
It's
there
going
we
to
go.
be *6. Oh,
So how is this substantially better than knowing the name of the drug and then Googling it?
Well, so what this does is that it tells you your medication. You can Google the name of a drug and get all kinds of information about it, but this is when you get a medication from a pharmacy and then you want to identify that medication when you're at home. This allows you to do that instead of having to have a family member read you the medication if you didn't remember how often or how much you were supposed to take. That's what this kind of solution does.
Thanks.
Yeah. Next question.
All right. Next question is from Umberto. I am unmuting you. And if you could also unmute yourself.
Can you hear me?
Yes.
Yes.
Oh, I just need to I have a question about pharmacists. Can you still hear me?
Yep.
Okay. So the what if you have a pharmacy? What if, like, you know, if like you need a pharmacy that's they don't know what those apps are, or those they don't have the scriptability or the CVS, and what if your pharmacy doesn't support that? How do you deal with that? Or if there's a pharmacist that maybe doesn't know about that app, those different accessible solutions,
Mm-hmm.
like maybe they're a little bit ignorant and they don't understand, like how do you deal with that? How do you best like I don't know how do you deal with that? I've been dealing with inaccessibility lately, so
Yeah,
thank you.
Great question. I think that depending on where you live, there's probably a pharmacy in your area that does participate in this. So switching pharmacies, and in that email, you'll get a link that will directly take you to the search page where you can search by zip code. So switching pharmacies is an option. Probably take less time, maybe a little less of a headache. Another thing you could do is ask to speak to the pharmacy, to the pharmacist, and then maybe ask to speak to the manager of the pharmacy, and bring them information about this Script Talk. Some of what I read about Script Talk is that it makes it. They've designed the software to work pretty easily for pharmacies too. It can be integrated in many different kinds of pharmacy software that they use. So just kind of bringing some information to them and educating them to help them understand how important this is to you and how much it would help you. I would, one or two of those routes, switch pharmacies or bring some information and really do some education. That's often what advocacy has been about for me is educating. Everett, you have any comments on that?
Yeah, I think it's just going into the situation expecting the ignorance and trying to reframe it as like Tim's saying, needing education, because we are a minority. It's not going to change.
Yeah.
That's my 35 years old talking. It's just not. And so going in with an optimistic attitude and having a plan for how you're going to dispense that education, you know, coming in with maybe a card or an Envision America website that'll be on your resource list tomorrow might help as well. And not just saying spoken RX, blah, 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 because a lot of this can sound like Greek even to people who are deep in it. And so making it, you know, accessible to the people who are making it inaccessible is a pretty good way to build that starting ground. And that's coming from someone, you know, I've been in this for quite a while, so and educated quite a few businesses on that, and just coming with a plan, not just sitting down and spitting out a bunch of buzzwords that they're going to forget before they go get their avocado toast and espresso.
I like avocado toast.
I do too.
Yeah. Great question, Umberto. Next question.
All right. Our next question is from Gina. You are unmuted.
Hello, Gina.
Hello, can you hear me?
Yes.
We can hear you.
Hey, all right. So I have the Script Talk machine, and that Script Talk machine is great, except there's a part of me that would like to download the app because, you know, it would be a little bit more portable. But I'm confused because the instructions are to hold the bottle at the iPhone facing up. Well, does that mean that I have to have the front facing camera on, or does it matter?
No, so it actually doesn't. I don't think it uses the camera. It's using that near field communication chip on your phone, which is used for, like, if you've ever used Apple Pay, or so it's kind of it doesn't use the camera. So they
Think
are
about the
basically
self-checkouts at Walmart. Sorry, Tim.
yes.
That's more about the technology that it's using. It's not using a camera, we don't think.
Okay,
Nope. So it was basically saying, like, put the medication on your phone screen, like, as a way to orient it, and then you might have to move it around the phone screen. But yeah, it's not using the camera.
okay, thank you.
Yeah.
And a strategy I found really helpful is, especially with chip readers where you're not sure what you're trying to put where, is to roll the object like an apple or a pill bottle, to just roll it on the screen. Like, you know, and that usually works for me as well. So hopefully that helps.
All right. Are we continuing with some more questions?
Yeah, we could take one or two more.
All right. The next one is from Alco. Alco, you are unmuted.
And then you also have to unmute, Alco.
There. Yep. Can you hear me now?
Yes, ma'am.
Okay. I may have missed it, but I just want people to know that Script Talk also has Braille labels.
Oh.
You don't get as much information as you do with the ones that speak. I've had both, but I really like the Braille labels because it's a great way for me to show off using Braille. Thank you very much.
So when you pick up your medication, you can request that not only
Yes.
do they put the tag on your medication, but they also hand you something in Braille.
Well, what I get, I do it through mail order. And
Oh,
so
okay.
they refill. Well, sometimes the Braille has something to be desired. It varies a bit. And sometimes they put a rubber band on the card to hold it there. But this time they came out pretty well. I was going to complain, but they straightened up. So,
nice.
but I just like being able, I don't want to hear all that stuff. I don't want to know the side effects. Surprise me. It just gives me, basically it gives the medication. My name is at the top, the medication, the dose, you know, like 1 tab twice a day or whatever it is. And that's it. And I think it might give the dosage too. I don't remember now because I just don't worry about it. I just know, but I line them up also just in case, but I'm very careful to make sure.
Well, thank you,
And,
Alco. That's great information.
You are welcome.
Thank
How
you.
do I get out of here? Mute me.
Yes.
All right.
And how about one more and then we can move on?
So it looks like we have a couple in the chat. There was a question about eye drops. What about eye drops?
So eye drops, they will put that, if you use Script Talk or that Spoken RX from CVS, those little RFID tags are tiny. So they can put those either on the eye drops box or on the bottle itself. And then you would put that on your phone and it would read that information to you just like if that little tag was on a pill bottle. They just put it on the eye drop bottle.
All right. And then there was one more about this topic from Victor. Is there a rep from Talking Script that can reach out to non-participating pharmacies? Is there a fee for the app for clients and or participants?
It's totally free for clients. My guess is that pharmacies would have to pay some to participate. But that's just a guess. I don't know how else Envision is going to make their money. So they're probably charging the pharmacies as an accommodation and accessibility solution. There was a number you can call. It was an 800 number to Envision when I was doing research on this that said, reach out to Envision to talk about how to bring this to a pharmacy that doesn't already have it. So there's an 800 number that you can call and talk to them about it. And yes, I'm sure they're able to, get a salesperson to help you and kind of move that forward. So thank you. All right, Everett, you're up.
Okay. Can you hear me?
Yes.
Okay. So the next thing we're going to be looking at is just a few different sort of monitoring tools that I like to call around the house. So these are tools for checking your weight and checking your heart rate. I am a semi-competitive runner. I like to run 5Ks and 10Ks. So these are both very important numbers. I would like to also shout out, prior to us doing these, to Ben Ritter from Exceptional Games for doing our video work on this, because videoing things is not always super easy, especially whenever it's accessible products and you're wanting to show how the different products work. So thank you, Exceptional Games. So the first thing we're going to talk about is the Taylor talking scale. It is a glass talking scale. There is a volume control, which also serves as the power control, and there's a button in the center. We're not going to go too deep into it. I think this is something that we're all pretty familiar with. It's been on the market for like 10, 15 years on Amazon and Maxiades. But Elena, if you could just go ahead and roll the video of the scale.
Now we're going to take a look at the Taylor talking scale. This is a glass talking scale. Typically retails from $20 to $40. Is sold in places like Amazon, sometimes eBay, and of course the trusty Maxiades, Maxiaids, which is your specialized market for products for blind, especially medical. So this scale takes 3 AA batteries. It can measure your weight in pounds and kilograms, and it also speaks 3 languages, but we're just going to take a look at basic operation. You face the glass away from you, and there's a volume on the top left side that you turn to your right. It's sort of a volume knob. You can turn it as loud as you want, and then face the glass so that it's facing the ceiling, and put it on the ground, and then take the steps of faith onto the scale.
225.6 pounds.
So all you have to do is step on, the scale beeps, lets you know your weight. Then it says ready for operation. If you don't want to know your weight anymore, which who does, you step off the scale and it beeps twice. We'll go ahead and wait for that. And that lets you know the scale's powered off. Takes 3 AAAs, and you do not have to turn the scale off after you're finished with it. Makes a great addition to anyone's bathroom or kitchen, especially with the holidays coming up.
Perfect. So that is the talking scale. Don't judge me. I just got off vacation. I'm working on that number, trying to bring it back down. But it's glass. It wipes off. Stores really easy. And you can turn that volume down so that you're not blasting your your weight to your entire local community. But I found it to be quite nice. I usually weigh twice because the scale will give you two different numbers on occasion if it sees that you're on a slanted surface. But for the most part, I found this to be just what I need, because you just follow the number that it gives you and try to make it go lower or higher as the case may be. The next product we're going to talk about is a accessible, out-of-the-box Bluetooth heart rate monitor. It is called a ticker heart rate monitor. I say the number in the video, but I can't remember what it is. It goes around your sort of chest area. It does have to be touching skin, and you want to make sure that whenever you're through with the heart rate monitor that you unsnap both snaps so that it doesn't sit there and try to pair forever with your phone. So that this is a heart rate monitor that you use with your phone with what's called the Wahoo app. They have an entire suite of workout apps that you can use, and you just pair it with your phone and go for the record workout button, and then your heart rate is displayed in the center of the screen. So without further ado, Elena, if you could play that video, that would be fantastic.
So we're now going to look at the Ticker CCC0 from Wahoo Fitness. This is a heart rate monitor. It's Bluetooth. It does not talk natively out of the box. So if you're looking for something a little bit more accessible, I'd recommend the Apple Watch. But this is a $40 to $50 on Amazon purchase that I bought whenever I started training for my marathon and my 10Ks earlier this year, and it's served me pretty well. You have to have the snap. It's a capsule that's attached to a sort of strap, and you have to have that snapped in for the heart rate monitor to register and to pair. We won't go through pairing today, but it does take one watch battery, which you can get at most Walmarts or drugstores. And this is the app that it's paired with right now. So we actually have it in a workout. It's doing what's called a recording of a workout. And we are going to jump cut to me with the heart rate monitor on so that you can see that the heart rate monitor is accessible whenever paired with your phone. So now I'm in the middle of a very strenuous run. I'm actually not, but I'm pretending to be, and we'll just look at the heart rate monitor as it goes. 71. It's at 71. 83. 86. And if I run a little bit faster, 91. It's going up, so it's low battery. Oh, and now my phone's even tired. It's got a low battery. So that's a brief demonstration of the Ticker CCC0. Highly recommended, and thank you.
And thank you, Passamy. The last thing we're going to work on, look at, explore is the MyChart accessibility. MyChart is sort of a one-stop shop by Epic, which is a medical company. They do databases and things. And so the MyChart is a one-stop place for you to go to look at your COVID results, also to view previous doctor visits, and to view your current plan with your physician. The main issue that I think we're going to hear about in the Q&A with MyChart, and that I've heard teaching it to people at Lighthouse, is that you have to go through all kinds of authentication with your doctor's office, and it can be pretty intimidating. So I'm hoping that the onboard process for MyChart gets a little bit more accessible in the next 2 or 3 years. But once you get it set up, this is what it looks like, and it is quite nice to use. So Elena, if you could roll charm number 3 is a charm. The third video, please.
Scheduling / paperwork system that doctors' offices are working on adopting for us to make the payment process and the paperwork that we all encounter whenever we first start appointments more accessible, and to sort of make a one-stop shop. So MyChart, whenever you first log into it, you'll get information from your doctor's office, and you have to go through quite a few steps. And you'll log into MyChart, and then you'll actually log into your system, which could be your patient portal for any number of doctor's offices. So for my protection, I do have the screen curtain on during this video, so I'm just going to take you through my chart once you've logged into it and show you some of the basic stuff that you can do with this application.
Airplane mode. Services in
So I'm going to go to my chart.
podcasts. App switcher. My chart. Active. My chart. My chart. Viewing chart for Everett. Account options. Button.
So account options would be where I would view the settings for the app.
Visits. Button.
Here you can view your visits. So let's double tap on visits and see what that shows.
Schedule an appointment. Button.
So I can schedule an appointment. This current system that I'm logged into, or portal, is for an eye doctor that I have.
Future. You have no upcoming appointments.
So I haven't scheduled any appointments with this eye doctor.
Past. Heading.
But as you can see that schedule button just before, I could schedule an appointment.
Documentation with Halston Age at Barnes Jewish Hospital.
And this is a documentation file. Basically, you can go in anytime 24/7 and look at all the information for your appointments that you've already had. You can download charts, you can download doctor notes, it all goes into my chart.
Viewing chart.
So now we're back on sort of my main chart page, and I'm just going to swipe to the right.
Share your COVID-19 info. Viewing chart for Everett. Share your COVID-19 info. Button.
So share your COVID-19 info. That's going to be where you can actually go in and show your test results to other doctors, and other doctors have information on your chart as well, so they can go in and look at that. So it really levels the playing field here.
Visits. Button.
Again, visits.
Messages. Button.
Messages. If you have CT scans or maybe a dental implant that's ready, that'll come up in messages and notifications.
Test results. Button.
And test results. So we're not going to go into any of these too deep, but I did want to show the very good, at least, accessibility of My Chart by Epic, and recommend seeing if your doctor's office has this option as well.
Okay. Everett needed caffeine on that one apparently, but we got through it. I hope that you found that informative, and we're going to switch now to the Q&A.
That was great. I have a question. I'm gonna hog the Q&A for a second.
Do so.
Why would somebody want to get a separate heart rate monitor that has to be attached to their chest and touch the skin, where you could just get like a Fitbit or an Apple Watch or something like that?
I think that these heart rate monitors, it's, first of all, it's like a preference, right? Like if you're a runner who wants to keep both of their wrists, free of a watch, that's one option. But then if you're doing something like biking or swimming, the watches, especially the cheaper ones, might not be so much of an option. And then the second thing I think is accuracy. I've heard from people who do, like a guy who's doing the race across America this year, that he prefers the heart rate monitors over the watches, because some people are like down to the number and crunching data and, needing to be really accurate. So I think that accuracy is another thing. And then affordability, like it's $40, that's pretty cheap for a Fitbit or a Garmin.
And the setup on that may be not quite as involved as setting up an Apple Watch with your phone and da-da-da-da-da.
Yeah, okay. It's just sort of like the Victor Reader idea, where you get something completely separate on your phone that doesn't rely on it, because you can go on a run with this thing and then take it back to your phone later. So, and I'm a big fan of that, is just having separate things that do separate tasks and not just dumping them all into your phone.
Cool. All right. Well, we can take a few questions.
All right. So we have one from a 510 number. You are unmuted.
Hello, 510.
And if you could also unmute yourself.
All right. Well, if you can always email us afterwards, or you can put your question in the chat if you can't find the unmute button.
All right. And then we have one from Sharon. You are unmuted.
Hi. Thanks for being here and doing the demonstrations.
Of course. Yeah. Thanks for being here.
Wow. Okay, my question is logging into my chart. I I chose to log in using a passcode, which is numbers, using numbers.
Right.
And I noticed that I don't know what it is. I don't know if it's a voiceover problem or what, but some of the numbers are actually blocked. So you cannot, I cannot tap on them. It'll say
weird.
1, 2, 4, 6, like that. When I try to use the phone method or the number method.
Oh, weird.
Okay.
Did you ever encounter anything like that?
It's just easier to log in that way, of course, rather than type in your username, your password.
Sure.
that
Yeah, a
kind of
little
thing.
faster.
But
Yeah.
those numbers will not, all of the numbers do not come up so that I can tap on them. Nobody's had that problem, huh?
I don't know. Everett, did you?
I think Everett is frozen, it looks like.
Oh, shoot. Okay. Oh, his power just died, so he's logging back in. I've never experienced that. I use a different kind of charting thing. I'm with a Kaiser Permanente, and so they have their own whole ecosystem of a chart system like my chart, but that's also accessible. But lots of other doctors' offices use this my chart. And yeah, that might be something that you would get some help with in your area. I haven't heard of that issue before though.
I don't know who to ask.
Yeah.
It's a strange
Is
problem.
there an assistive technology instructor in your area or a services for the blind near you or any sort of community-based blindness organization?
Well, yeah, there's something in my building. I'll ask around. I don't know why I didn't think of that.
Well, hey, that's why we come to these things and share
Yes.
ideas and talk
Okay.
and yeah.
But
Okay. All right. Do we have
thanks.
some other questions?
Yes, we do. So our next question is from Perla. You are unmuted. And if you could also unmute yourself.
All right. Well, we can't hear you. You got to unmute yourself. Oh, hey, there's Perla. Okay. Hi.
Can you hear me?
Yep.
Okay. I might have an answer to the last woman with the numbers. If she's using iOS, I had a situation with my iPad where the 0 would not work when I was trying to put in my codes. And when I took it down to Apple, what the gal figured out was that it was too close to the edge, the bottom edge. And so it wouldn't read it. So what she did was she made my numbers smaller and that solved it. So I don't know if that's her situation, but because the gal at Apple said she had never seen anything like that before. And it was, she just figured it out.
So this is Everett. The numbers, sorry about that. The numbers on my chart are a little bit like Tim, like the numbers on the credit on entering a passcode for your credit card number. So they're not actually numbers, they're buttons that are numbers. So it's like they're very big. And so that makes a lot of sense that your friend had trouble. But generally the numbers are more spaced apart, kind of like a big telephone keypad. And I think it's to make it more accessible, and it doesn't actually help it because you can't actually read the passcode that you're entering on my chart.
Oh,
so
dude.
Really good question about the numbers. There's a button in the top right that will let you use Face ID or a passcode, but it's not always the easiest in the settings in my experience to get that reconfigured. So really good question.
Okay, well, anyway, I just thought I'd throw that out.
And thank you.
Worth.
Thank you very much.
Thanks
Bye-bye.
for the info. All right. Well, we're going to move on to the last section here. So this is my section, and I wanted to just let you guys know that I did some research on some of these talking home health products, like a thermometer, an oximeter. So one of those devices that you maybe in the doctor's office have had placed over your finger that reads your pulse and the level of oxygenation of your blood, and a home blood pressure meter. So something that you're able to use independently that goes around your arm and measures your blood pressure. So look several different places, and actually Alco, who was another person on the call, she's friends with a fellow who runs a company called Guide Lights and Gadgets. And this guy's been running this company for a long time, but he's got quite a story about his kind of role in healthcare and what that used to look like, and some of the reasons he came up with and found these products that work really well. So he was an executive in the healthcare, health products, I think is what he said. And he spent a long time trying all kinds of different devices, a thermometer, pulse ox, and blood pressure, trying these different devices and really not finding things that were very accurate and accessible. So he's found these 3 devices, and he sells them on his website. And I don't usually, make plugs for independent businesses or anything like that. You can find all kinds of products like this on Maxi Aids, and actually the Lighthouse. We have a low vision store that you'll be receiving a link to, and you're welcome to do all kinds of shopping of your own and trying the best ones that you like. Some even off the shelf. There was a thermometer that goes in the mouth that I found a number of years ago called Kinsa. I bought it at Rite Aid or something like that, and it connects via Bluetooth to your phone. And I was able to use that to take my temperature and my kids' temperature. So there's many different options. The reason I'm showing these is just because they work so well and they're so simple to use. So with the first video we're going to watch, I'm going to do a demonstration. So again, these are the products that I ordered from Guide Lights and Gadgets. And the first one we're going to look at is a thermometer. It's a contactless infrared thermometer, and the pulse ox, oximeter that you put on your finger. So let's run that first video, Elena. Hey everybody, we are going to look at a couple of the products from Guide Lights and Gadgets. The first one we're going to look at is a contactless infrared thermometer, and the owner of that company, Barry Shorier, he purports that it is extremely accurate. So it can actually give you the same body temperature reading multiple times, where a lot of the products on the market can't. I found this super easy to use, pulled it right out of the box, pressed the trigger, and it started talking right away. There's also a large display. I'm holding it up and pointing it towards the camera. There's also a large display that shows the numbers in kind of a larger print too. So I'm gonna press the trigger on here. And the best way to do it is holding it about 2 inches away from your forehead. So I'm going to go ahead and do that. I put it on my forehead, and then I'm going to pull it away. I'm going to press the trigger button, and let's listen to what it says.
Your body temperature is 98.7 Fahrenheit degrees.
Body temperature 98.7. Let's do it one more time just to test the accuracy. So here we go. Same measurement.
Your body temperature is 98.7 Fahrenheit.
Exactly the same. Awesome. It's super easy to use. There's a few other buttons on the back that I actually didn't even have to mess with at all. Those are different settings. We're going to look at the oximeter. So this is the thing in the doctor's office that they put over your finger to read your pulse and to test your the oxygenation of your blood. This was also super simple. I just installed the battery in it. I pressed the button once to turn it on. So I placed it over my finger, pressed the button once to turn it on, and now I'm going to press it again to actually do its reading.
Start measuring. Count down 30 seconds.
So if you didn't hear that, it said, please keep still, start measuring, counting down 30 seconds. So this is going to measure how oxygenated my blood is and my pulse. And again, this product was super easy to just pull out of the box, put a couple AAA batteries in, and press the button, and it started talking. So we should be coming up on a measurement.
Your blood oxygen saturation is 95. Your pulse rate is 82.
All right, well, 95 isn't the best, but hey, at least it's not below 90. And again, these two items can be purchased through Guide Lights and Gadgets, which is a pretty cool little company that we can talk a little bit more about. But really happy with these two. Super accurate, really easy to use. I wish that the sound was a little bit better. I was using my webinar camera to try to pick up the sound of the voices on those two devices. But again, really easy to use. I just put batteries in and I press the button. On Barry's website, there's audio files that give tutorials and demonstrations. And then he also has a manual for each one of these things that's specifically designed for people who are blind, provides really good descriptions of these products, that kind of thing. So I got, actually, let's watch this last video, which is the blood pressure cuff. I did the whole thing myself. I didn't get any sighted assistance in setting this thing up, putting the batteries in. I listened to some of Barry's description on how to use it, and that was it. So let's run that video, Elena. Hey, everybody, we're having a look at another product distributed by Guide Lights and Gadgets. It's a talking blood pressure meter. And just like the other two that I showed a video on, this was super easy to use. Pulled it out of the box and put the batteries in. I connected the tube that goes from the blood pressure cuff to the side of the device. Connected that, and I pressed the power button, and it started reading my blood pressure right away. So this device, I'm going to hold it up for you. This device has just some simple, large, easy to feel buttons on the front, and the bottom right is the power button. And it also, once you turn the power on, it starts reading your blood pressure. And there's a setting button, and then at the bottom left, there was a memory button that actually reads the last few blood pressures that you've taken. So I'm going to set this device down on the table because that's really the most accurate. I have the blood pressure cuff on. I'm not sure that's in the camera, but that's okay. And I'm going to press that large button, and I'll tell you what it says. You may be able to hear it, but it's not quite loud enough for the microphone to pick up. So I'm going to press that bottom right button. Stay still and do not talk until the measurement is complete. And I've actually, this device came with Barry, the guy who runs Guide Lights and Gadgets, sent me accessible MP3 files with demos. They came with electronic manuals that were super easy to use. So really just kind of all the tools you need here for your home health to be able to do that accessibly. So I'm just relaxing, and I'm going to hold the device up as it's finishing. I hope that doesn't throw off the reading, but I'm holding it in front of the camera.
Blood pressure is solid pressure 130 millimeters of mercury. Diastolic pressure 67 millimeters of mercury. Your pulse is
Okay, so pulse 82, 138 over 62. And I think you probably heard most of that. But again, it was just a pleasure to install this thing and use it. And it was just great. So thank you. All right. Here's the deal. My blood pressure is pretty good. So but it didn't come out that well in that video because it said do not talk and do not move while you're using this device to get an accurate reading. And I was both talking and moving. But when I did it 2 or 3 times before that, with the device on the table and me holding still, I had like, I don't know, 112 over 65 or something like that, a few different times. So it is accurate, but when I was moving the device around to try to hold it in front of the camera, and I didn't shut up the whole time. So anyway, it really was pretty easy to use. And so each one of these devices is $50 from Barry's website. And now we're actually getting pretty close to the end of our webinar, but we'd like to open it up for a final Q&A. You guys have some questions that we can help answer?
All right, it looks like we have one from Perla. You are unmuted.
Hey, Perla.
Hi, can you hear me?
Yes.
Has anyone had any experience with the cardio blood pressure? It works, but it's not very accessible when you put on voiceover on the iPhone. It just says, I don't remember what it says because I haven't used it for a while, but it doesn't give you the information that's there.
It's called the cardio blood pressure. Is it a device?
Yeah, it's a device and it hooks up to your phone, to an app on your phone. Cardio is the name of the company that makes it. And I've reached out to them. I've gotten zero support.
Oh man, that's so hard. You just never know which piece is going to work or isn't going to work when you get something. Everett, have you heard of that device before?
I have not. No. I think your best bet would be Apple Watches are starting to do blood pressure as well. So
For
maybe
real?
yeah, that's what I've heard for the newest watches that are coming out. They're supposed to, which is going to completely change the game. They already do heart rate. But I would maybe call up Apple and see if that, is an option, or look at maybe into this guidelines and gadgets, because it sounds like you've hit a bit of an impasse with your other company.
Yeah,
I apologize for that. That
no,
stinks.
don't apologize. Not your fault. Thanks a lot.
Yeah,
All
yeah.
right.
I guess those Apple Watches do pulse ox too, right?
Yeah, they
blood
do
oxygenation.
Oxygen and heart rate.
Yeah.
And they're supposed to be doing blood pressure, which is going to be so much fun for insurance companies. I can't wait, because then they're going to be seen as durable medical equipment. That's going to change lots of things.
Wow. Okay, thank you.
Thanks, Perla.
Thank you, Perla.
Next question.
Then, we have another question from the 510 number. You are unmuted.
Hi, Dirk Nyhart again. Just a statement of admonition about the Taylor talking scale. I bought one from Maxiades and I put it under the sink, and when I dragged it out, a leg fell off. Maxiades was good and sent me another one, no charge. But the point is, if you get one of those scales, you have to pick it up and move it before you step on it, and certainly not drag it along.
Good information. Thank you. Appreciate it. Other questions?
We have a question from Umberto. You are unmuted.
I have a question about accessible. What do you guys know about any accessible or Bluetooth or Wi-Fi based glucose meters or glucose monitors, insulin type monitors, glucose injection devices, or whatever they use for diabetes? All these different things. And what about apps? Are there any apps that control refrigerator temperatures or freezer temperatures, any of that stuff for different medications that use that? Thank you.
Yeah, thank you, Umberto. So we were looking into including the glucometers and stuff like that into this webinar, but we just kind of ran out of space of what to include and what not to include. But really great question. I know that there are all kinds of there's a few different options out there. Not sure for devices that control the temperature of your freezer or your refrigerator or anything like that. But I can make a note and get back with you with some options, but I didn't look into that stuff too much for this webinar.
Again, it was on the list. I know that the Dexcom, the G6 is what I've heard used. But again, we'll get back to you on resources, because they're The Dexcom makes a really good the glucose meter, and I believe they also provide Braille options. So we'll be back in touch with you about that.
All right, and it looks like we have a question from Mary. You are unmuted.
Hi, hello, thank you. So a couple things. One regarding the blood pressure monitor. Well, first regarding the question about diabetic, the insulin and the glucometers. I'm not a diabetic myself, but the American Council of the Blind, the special interest affiliate, Diabetics in Action, they have a lot of information on that subject. So,
Oh, awesome.
if you went to like the acb.org website, and then through there, you can get to the affiliate page for Diabetics in Action and maybe reach out. I don't know how much information would be there, but the contact information for the president, because they're doing a lot of advocacy and education on accessible glucometers and all of that. So they would be a really great resource for you for that. The blood pressure monitor that you demonstrated, I actually have. I bought it from Barry. And one of the things that probably people need to maybe get more information about is the proper way of putting a cuff on, because that really will determine how accurate a reading you get. And that was the one thing that I wish maybe had been a little bit more clearer in the tutorial from Barry. I actually took it to my doctor's office to make sure I was using it properly, because it's really important to make sure that the cuff is on correctly. But the machine itself is really easy to use, and yeah, it's definitely and I'm assuming I'm getting an accurate reading, so it is a very good machine to use.
Awesome. Well, thanks for
So.
the info there. Yeah. Any other questions?
I don't see any.
Well, great, everybody. It was a pleasure. Don't forget, be looking for that email with all those resources and a link to that survey. You can definitely help us with your feedback. Would be so appreciated. We thank you again for attending. And next month, I'll be sending you some info about what our webinar is going to be next month. All right. Take care, everybody.